Project Zeno has been committed to the pursuit of universal health coverage through health system development and medical education reform in Tajikistan for nearly 20 years. The project has ensured a sustainable partnership between Switzerland and Tajikistan through continued collaboration with the aim to develop affordable and sustainable models for primary healthcare strengthening.
Tajikistan has made important progress to move away from the centralized and specialist-focused healthcare system that existed in the Soviet era towards a family medicine-oriented primary healthcare system. There's now a basis upon which to build, and the people of Tajikistan can start to envisage the right to basic healthcare.
Project Zeno works to ensure that people in rural areas of Tajikistan enjoy better health thanks to improved primary healthcare services through 5 core areas: strengthening management capacity, health planning, community engagement, rehabilitation of primary healthcare facilities, and medical education reform. Project Zeno builds management capacity within the healthcare system by strengthening the management skills of primary healthcare leaders with a focus on practical aspects of management, such as planning and problem solving, which are all adapted to the local conditions. Health planning is critical for stronger district and facility management. Business planning is an effective managerial tool that has improved management capacity and the health of the populations, particularly the most vulnerable groups. Business planning is now in 33 of Tajikistan's 58 districts, with high levels of community engagement.
In a country with limited resources, the most essential aspect of being able to provide effective health services is to properly plan and manage resources, be it human resources, financial, or medicines, or supplies. It is central to the concept of primary health care that not only health professionals, but also local decision makers and community are shared responsibility for population health.
Project Zeno is committed to strengthening the role of communities and enabling people to exercise their right to health.
Our experience shows that by directly involving communities and health staff, it facilitates collaboration as equal partners. If people have a say in deciding the focus of community health work, they are much more likely to engage and respond to the health intervention.
Since the start of the project, rehabilitation activities have been carried out in over 170 facilities throughout Tajikistan. In combination with the overall health system strengthening approach of the project, the renovation and maintenance work has been associated with consistent improvements in the quality of care. Medical education reform aims to modernize the education of family doctors and nurses by putting a greater focus on practical and clinical skills as well as communication techniques. Students are given early exposure to rural practice realities, in which they work directly with patients under the guidance of experienced colleagues.
The most important legacy of Zeno project is twofold. First of all, it worked closely with national and local institutions to sow the seeds of sustainability, recognizing that to build capacity, it takes a lot of time. And secondly, it always, from the very beginning, promoted the principles of good governance by modernizing education of health workers, by improving quality of care, by empowering population and community to participate in health decision making. Most importantly, also by enabling primary healthcare managers to listen to the voice of communities.
As the percentage of people living in rural areas is rising at a faster rate than in urban areas, providing healthcare to the rural population remains an immense challenge. Through the strengthening of primary healthcare and the building of a workforce of well-trained doctors and nurses, Switzerland is proud to have contributed to the improvement of health outcomes in Tajikistan and act as a model for other countries working towards universal health coverage.